And when you're ready, we'll do,
The clap.
I'll count to three. Ready? 1, 2, 3. All right. Dr. Lauren Fitzgerald. First of all, anyone out there, if you're listening to this podcast right now, I'm just going to let you know that we just went through a little something trying to get this set up.
Yes, we did.
But how synonymous with that is that with what's going on in the world right now? People are trying to figure out
100%.
a new space.
100%. And figuring out how to trust and believe that we will overcome the struggle and survive on the other end of it.
And I think trust and believe. I think the thing that's really interesting, first of all, I love you. Lauren has, been there for me in other ways that we don't have to talk about today.
No.
But I think what's really interesting is we were just talking. I usually record my podcast in person, or I have these other mics. And because of the coronavirus, I'm now doing something different and something new and troubleshooting.
Yep.
And before we get started and you telling everyone what's happening in the world with their health, how are you getting along with the coronavirus and changing things up?
I mean, mine is not much different because I do work from home. But I've definitely, when I travel, all of my travel has been canceled because I'm taking social responsibility and quarantining myself, even though myself and my significant other are not infected.
Yes, good for you. Same here. We
Yeah.
have, we're so blessed that Scott, myself, the boys, mom and dad specifically,
Oh,
because
yeah.
mom had a really bad fall and a lung
Yes.
situation that happened the other day. So anyway, let's get to the point.
Let's get to the point. We're going to talk all things coronavirus,
We're going to talk all things.
COVID-19.
Yes, we are. And so basically, I'm just going to have a bunch of questions for you.
Absolutely.
And you're just going to shoot at it, because I think that what's happening in the world is people are Googling, they
Yes.
see memes, they hear conspiracy theories.
Yes.
They, they're just stressed
Absolutely.
and they're just talking instead of really listening. So today, hopefully they'll listen.
Absolutely.
So first question, what is COVID-19 and what are the symptoms?
I love it. Well, before I even answer that, I want to make sure that your audience knows I'm an MD. I'm a medical doctor. I'm trained board certified anesthesiologist. I'm not an infectious disease doctor. I'm not a virologist. But in medical school, that is part of our training. I mean, we deal with infectious diseases like coronavirus all of the time, but I've never seen it to this extent. So I want to make sure that everyone knows that this is not considered medical advice. I'm a medical doctor, but not their medical doctor. But this is definitely used so that we can help educate the public, because there's so much bad information out there, and you have to really be careful about who you let into your thought space when it comes to this topic. So, okay, so to answer the first question, so just like we saw in the 80s, the difference of HIV and AIDS, we have a virus name and then we have the disease that it causes, right? So the virus is actually SARS corona type 2. And we actually saw SARS type 1 back in my third year of medical school in 2003, and that mostly hit the Asian population. I remember we did have to take some precautions being in the hospital because I was a third year medical student, but it never got to the point where it was a pandemic affecting the whole world, and specifically our country, the United States. That being said, it was caused by this type of coronavirus. There's tons of coronaviruses actually, and most of them don't cause this kind of havoc. But the difference between that type and today's type, the type 2, is it causes a different kind of disease. So the disease that it causes, we are calling COVID-19. So that's the difference between the virus that causes and the disease name. Does that make sense?
It does, because I was one of the ones where when it was first mentioned and they started quarantining the cruise ships and
Yep.
people were, traveling back and forth across the Pacific. Just a little backstory, when Melissa McAllister and I were coming home from Australia, they stopped us and they were like, "Were you in Asia?" So
Yeah.
I really just appreciate that, especially going into the history of it, like helping people understand like this isn't the first time that something like this has happened, but taking the precautions are necessary. And so anyway, I was going to say, I was Googling initially, which is why I'm
Dr.
telling
Google,
people
you
not
need to
to.
stay away from Dr. Google.
Right. It's ridiculous.
It is ridiculous.
So I was Googling, and originally when I looked up coronavirus, I was like, it's the same as every other type of cold.
Right.
So why are they
Exactly.
calling it coronavirus? So thank you for just kind of being very specific to why it's named COVID-19. Okay, so
Absolutely.
what are the symptoms?
So there is a great chart, and I'll share it in my Instagram stories as well, because it's a chart that compares the different signs and symptoms of COVID-19 to the common cold, to the flu, to seasonal allergies. Because let's face it, the other three we're not quite as concerned about, but you want to make sure that if you have COVID-19, that you are 100% self-quarantining yourself, right? So the biggest thing that we worry about, whether you have one of these symptoms of one of the four different diseases that I just talked about, COVID-19, cold, the generic cold, flu, and then seasonal allergies. The thing that we worry about most in this is the shortness of breath. So
Mm,
what we are finding is that what's so different about this virus is that the way it presents is not typical of anything we've seen. And so, like for instance, in China, there were a whole host of people that were having GI symptoms, and they were thinking that it was completely not related to this particular virus. So they admitted all of these patients onto a floor thinking that it was a GI infection. And sure enough, it was actually this particular virus. So and that's the scary part of this. And I want your listeners to go away not with fear, but with a healthy fear, because we do have to have a healthy fear of this and understand that this virus doesn't only present with fever in everyone, or doesn't only present with a cough in everyone. There are a lot of people that are infected with this virus that don't have any of those symptoms yet are still infectious. And that's the scary part,
that is very scary.
right?
Okay, I'm going to move to the next question. How should we protect ourselves?
Man, so I will tell you this. At the end of January, when things were happening in China, when I
Mm,
heard that they were building a whole hospital just to take care of this, that was when I started to think this might be something different than what we've seen in the past. And I even wore a mask when I flew out to California for my conference. The fact is that at the point that we have gotten, especially in the United States, and I know you have listeners from all over the world, but this pertains to everyone really in the world right now, is that we've got to take social responsibility and literally quarantine ourselves. And I know that that invokes a lot of fear and anxiety in a lot of people, but we keep hearing about this curve, right? We want to flatten the curve. We
flatten
want
the
to flatten the
curve. Yeah.
curve. And let's just be honest. I'm sure some people are like shaking their head, but they're like, I don't know what that means. Can we just talk about that?
It's so ridiculous. You got social distancing, you got flatten the curve, you got,
Those
you
are the
have all,
buzzwords.
I mean, people have nicknamed coronavirus Rona. I'm like, no. And it's my people. I'm
Oh, I
sorry to
know.
say it's my
I
people.
wasn't going to say that, but my best friend Jessica told me the same thing.
And I know, some people are like, "Oh my gosh, why are you guys laughing?" It's just the
You
point of how this brings up so many different things. So anyway,
So
back to
true.
flatten the curve.
So
Flatten
true.
the curve.
Flatten the curve. Okay. So let's take something that almost all of us have had, the chicken pox. Okay.
Mhm.
The R naught, which R naught basically means you, Shaun T, get chicken pox. How many people per one person are you going to infect? And the R naught, the higher that number is, the higher the infectivity is. So chicken pox, super high R naught. It was like 10. That means for one Shaun T, you're going to infect 10 different people,
Wow.
right? So the R naught of this particular virus, it's not on the low side, but we're thinking it's somewhere between 2 and 4 people. So right now, that doesn't sound like a whole lot, but if you think in exponentials, that that doubles very quickly. I heard an analogy. If you handcuff someone to the top of the last row at the Yankee Stadium, and you start on home plate and you start adding a drop of water to the stadium, and then the next minute you drop 2 drops, and you keep exponentially doubling it, how long do you think before that person who's handcuffed at the top of the stadium is going to drown?
A
It's like
year?
12 and a half hours.
Wow.
So that's the power of the exponential, right? The R naught. Now, the R naught of this virus is not a set number. The universe is not like, okay, your R naught is 2. It totally depends on what we as humans do and how we interact. We're social creatures, right? It's really hard for us to stay quarantined. But the fact is, right now, we want that number of infectivity to be on the lower side instead of the higher side. And that's completely dependent on those of us that are healthy. Like if you get coronavirus, I'm not concerned about you being in the 20% or less that are going to get severely ill to the point that I'm worried about your health. Yeah, like you dying, right? But let's take your in-laws. You could be carrying the virus for 5 to 12 days. That is the time in which you could be infected with it and not showing symptoms. Scary, right? Like in theory, you could be infected right now if you went out to, go celebrate St. Patty's Day last weekend, like so many people here in Chicago did.
And sharing drinks and the whole thing.
Absolutely, because your wits are definitely down when you're drinking alcohol, making dumb decisions and spitting and whatnot, right? So 5 to 12 days before you can show symptoms. And so in that time, you're going to the grocery store, you're going to wherever, and these people, you're getting infected. And so if you get sick, you're probably going to have, maybe a week where you're feeling really crappy. You're running some fever. You're probably going to have a cough. You may or may not have some of the other symptoms that are not super common, but most people are running fever and having a cough, right? But your immune system's going to fight it, and you're going to get over it, and you're going to have immunity to it for, they think, about a year or 2. Right? You're not immune to it forever.
Like the chicken pox.
Exactly. But what if you get your mother-in-law infected? Our population of 65 and older are the people that we're worried about having severe outcome. And this is where we have got to be selfless in this. And this is where I made a post today about our young people, like our millennials who, we all went through that stage where the world revolves around us. And we really were like, oh, it seems just fine. I'm here on the beach in Italy. It doesn't seem like anything. No. Honey child, you need to realize that this is so much bigger than you, because in this whole time that you're like, well, I don't care if I get it because I'm young and healthy. You could be infecting someone's grandmother or someone's immunocompromised loved one that's on chemotherapy, people that don't have a normal immune system. And what they're seeing is that people that have a severe reaction to this, that are at way increased risk of actually dying from this, they need ventilator support, which is a breathing machine, from 3 to 6 weeks. Can you imagine if someone
to help them breathe?
Yes, to keep them alive.
Yeah.
And it's scary because we're hearing off the record from some doctors in China and Italy that they're considering euthanasia in some of these people because they don't have enough breathing machines to keep these people alive.
That's really sad.
It's terrible because it's have you ever been to the place where you can't breathe?
I've actually never been there.
Thank goodness, right? The only people that can relate are people that have had a near drowning experience or have like asthma.
Yeah.
Right. And that is the worst feeling, when you breathe in and you feel like you're hungry for air, because the exchange at the base of your lungs, called your alveoli, are not getting oxygen into your blood, and you feel like you're literally starving for air. It's terrible. And that's why the social distancing, it's not just about you not catching it because you're not worried because you've got a good immune system. It's, you don't know how many people you're going to infect. We're not thinking that the R naught is 10, but we're thinking it's somewhere between 2 and 4. What if one of those 4 people that you get infected is your grandmother that, is at a nursing home that you go visit on a regular basis? This is where we just have to take social responsibility.
Yeah. I think that hearing that a lot of people in the nursing homes are getting sick, you're saying to yourself, well, their loved one may not even have known that they had the virus because they're young and healthy, and they might have felt like, oh, I have a little cough and it's not a big deal.
Absolutely.
Or they're just not having any symptoms at all, and they go and they kiss grandpa or grandmother or whatever, and next thing you know, they're sick, and they're like, how did you get it?
Right.
And they don't know. So you answered the next question. Well, no, this question. How long are you contagious after you show the first signs?
There are some speculations that there is still viral shedding up to 32 days after. And that's the thing, we don't know. Like, some of the smartest people, smartest virologists in the world are looking and studying this virus, because it's unlike anything that we've ever seen before. So
Mm,
that's the reality of it, is that it literally, you could be past your symptoms but still shedding the virus that can still infect people. And that's why, when you said, kiss your grandma, you don't need to have that kind of direct contact to get infected. That's the problem. I mean, the latest, I believe that the British Journal of Medicine published the latest thing that we know about this: how long it can stay in the air, how long that it can live on surfaces like cardboard, copper, steel, and plastic. And I mean,
mm.
it's a long time, which is scary. They say up to 3 hours in the air. So in theory, if you're walking in an area that someone just was like, oh, I'm by myself, I'm going to cough and let the respiratory droplets just go in the air and not cover their mouth, you could walk into an area up to 3 hours later and breathe in and get infected.
And so how does that affect what's the difference between being inside like a pub and then being outside? Like, if you say, I want to go for a run today.
Right. So it's literally, it's imagine, it's just odds, it's statistics. If you were in a closed place that has less room for air particles to move and respiratory droplets, you have a higher likelihood of getting infected if someone that was infected with coronavirus was in that vicinity. You go out for a run, you're talking about an infinite amount of space out in the air that most likely, even if someone was running down that path before you, it's not going to be in that place because it has an infinite place to move. Does that make sense?
Yes, it does. I just wanted to make sure because I know a lot of people are like, I want to go outside, I want to go for a run, and
Right.
excuse me, my voice. And just trying to help people understand that you shouldn't be going to the restaurant right now.
No.
Because last night um I had to go get something for the podcast, right? But I was like, the Apple store was closed, and I was like, thank God, that was a sign.
Right.
So, but on my way out of the area, I saw these restaurants and they were packed. And I'm like, people, I mean, even I had to go to the grocery store yesterday.
Yeah.
I had my wipes, they had hand sanitizer. It was like everyone's taking these extra precautions and people are still going to the restaurant having drinks. And it's not like the servers or the waiters or waitresses, whatever you call them. It's not like they're wearing gloves or
Mm-mm.
masks so that it's like you have to be careful. Okay. So you answered a lot of the questions that I had in your last questions, but I want to ask this question because I think it's interesting. Maybe you kind of answered it before, but if you catch the virus, is it possible to get it again?
Okay, so that's a great question, because up until last week we didn't know the answer to that for sure. They are showing that once you get infected, you do mount an immune response. That being said, for the immunocompromised, obviously we're not concerned with them not mounting an immune response. We're worried about them actually dying from it. So if you have a normal immune system, yes, you'll most likely be sick from it, feel like crap for, a week or so, and then your body will mount its own immunity so that if you happen to be around someone else, you won't get sick again.
Good to know. Okay. You answered that question. You answer a lot of questions in one answer.
Well,
You're
I,
so
well,
thorough.
well, I knew that we could cover a lot in a short amount of time, because these are some basic facts that really I want to make sure that your audience knows that your own life is not really what I'm fearful of for most of your audience. Because most of your audience, I mean, they work out from home. They're doing things that have built their own health and immunity, so
Mm,
that this is what our immune system was built for, right? But the fact is that the people that we love the most, our elders, and then some immunocompromised people, those are the ones that we really truly need to act selflessly and say, okay, it's not worth it to take that risk. I'm just going to sacrifice and spend the next few weeks at home and getting out as minimal as possible.
And with that said, if you do get it, what else should you do besides quarantining yourself?
That's a great question. So this, like most viruses, there's no cure for it. There's no antiviral that you can take to help decrease symptoms. And literally it's what we call supportive care. So supportive care can mean anywhere from you're taking Tylenol to help decrease the fever. I'll tell you, the last time we saw each other in person was in New York, where I picked up this actually, it could have been the coronavirus. I never went to go get tested for flu. I felt like it was the flu, but this was right when things were happening in China. And the thought crossed my mind, but the fact is that I wouldn't have gone to get tested to see if it was flu or corona because my symptoms were containable. And I opted not to take acetaminophen, which is Tylenol, because my body's own immune system was meant to fight that fever, right? And so, supportive care can look anywhere from the zinc lozenges, I can't say that word, that, will help sore throat, because if you're coughing a lot, oftentimes there will be a sore throat involved. Ibuprofen is in the class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. And there is one paper out from France that's saying that people that are taking that, if they are infected with coronavirus, it's getting worse. Now, that is a one paper thing. I don't know the validity of it because I've seen other papers out of Vienna and other places that say that they haven't noticed that thing. NSAIDs are typically taken for like body aches and sore muscles and whatnot. Acetaminophen, which is Tylenol, are typically taken for the fever. So right now we're recommending just stick with the Tylenol, the acetaminophen, if you're going to take over the counter stuff. And then, supportive care, like making sure you're hydrated, sleep. I cannot tell you how important you getting good sleep is for your immune system. Sleep, sleep, sleep. I'm telling you right now, you've got to prioritize that.
I want to make reference to what you said about being in New York because Sam, he was the first person to get it that we
Right.
all knew.
Yes.
And then he even said, he said, I really believe I had the coronavirus because he went and got tested for the flu and it wasn't the flu.
See, knowing that, because Dr. Elameen's wife tested positive for the flu. So I was around a few people that I knew got tested that it was positive, but then hearing that about Sam, I really, because mine, I used to have asthma ever since I've changed what I eat. So I stay away from dairy and gluten and those kind of really inflammatory foods. And I used to be on a lot of asthma and allergy medicines. I've been off of those now for a good 5 years. But when I do get sick, and it's so rare, but when I do get sick, I get what's called reactive airway. And when I was sick with whatever it was after New York, I literally was air hungry. Like my cough was so bad. I wouldn't be surprised if it was the coronavirus instead of influenza. But again,
Yeah.
I survived it and I'm
Yeah.
good.
Everyone got sick, and I'm knocking on wood right now, except for
Yeah.
Scott and I. Scott and
No,
I were
which
the
is
only
crazy.
ones. I think Alex had something the week before, but it was crazy. Okay.
Yeah.
I have two more questions. How
Yes.
do I keep myself motivated in the house all day long?
Oh, man. Well, of course, you're the king of workout videos from home.
I mean, I did put up a post
I
yesterday
saw.
that talks about here are the 7 things you can do, especially if you work from home and you're not used to it and you have
Yes.
kids and you don't have a babysitter. But from a doctor standpoint, a medical doctor standpoint, what are some of the things that people can do?
I mean, well, there's a few things. If you are infected, it really is important for you to quarantine yourself off. You want to try your best to not get your loved ones sick. So if you share the same roof with other people, like Chris, he did a great job of letting me quarantine myself, and he never got sick when I got back from New York and had whatever that was. So if you're sick, that's one thing. If you are not sick and no one in your family underneath your same roof is sick, then man, the community is still so important. And people that have never done stuff like Zoom, like we're recording this podcast on Zoom right now, FaceTime, Skype, like getting connected with other people, I think is so important because the mental aspect of this is huge.
Mhm.
There are a lot of people that are facing like super bad anxiety that were already having underlying anxiety issues, and now this is just hyping it up. People that have never experienced anxiety are experiencing it. And I mean, let's face it, we're creatures that were meant to be connected with other humans, and we're meant to move. So it's a obvious, you need to get some kind of exercise, movement, whatever you want to call it, at home, whether it's the insanity at home or just getting out and walking your dogs outside. You got to move, but you also got to be connected. And literally the thoughts, the whole concept of thoughts lead to emotions that lead to actions. Like, you have to keep that in mind. So what are you filling your thoughts with? Are you following a bunch of accounts or a bunch of news channels that are constantly giving you all negative stuff? Those thoughts will change your emotions and will lead to actions that
Negative actions.
absolutely, absolutely. So just be careful and mindful of that. I hope that your podcast listeners walk away with hope, because this we're not at the point where everyone's going to die from this, thank goodness. But we are at a point where you can take personal responsibility at, okay, I'm going to sacrifice and stay home for a few weeks. You guys, that's nothing. This is what most people would actually dream of, like
You're looking at the person. You are
right?
looking at the person that, while I'm not happy that people are sick and we have this crazy epidemic happening, but I'm very happy to actually have this time with my family. Like today, a lot of things I miss, because of
Right.
a working, traveling
Right.
parent.
Yep.
But this morning, like, our boys got up and came in our room for the first time today.
I saw
Like
that. I was just watching your stories. It made my heart melt.
it's those kind of things where, and Scott and I are like working together. Like, I'm working in the morning and
Yep.
he's working in the afternoon, and then we have the grandparents that are, helping out, and it's
Yep.
it's really, really just connecting the village, and I think
Absolutely.
that instead of being like, I'm home with my spouse and I can't, I'm like, take this opportunity to like love them and to
Absolutely.
appreciate them and to do
Absolutely.
some. Our kids are so young, they can't play board games yet, but we can paint, we can
Absolutely.
sing, we
Yep.
can dance, and of course there's going to be screen time,
Of course. Of
but
course.
keep it healthy. Like yesterday, our boys, they love screen time. We keep it as educational as possible.
Right. Right.
But what I said is, I was like, I'm going to work a little bit here.
Yep.
And every time a commercial came on, I was like, come here, guys. And I had a couple books lined up, and I was like, we're going to read this book during a commercial.
I love that.
And then they run back, but I have to get done what I have to get done, and
Absolutely.
screen time helps. So it's also being creative with
It
your
is.
time.
It
And I like to
absolutely
tell
is.
people being creative. So last question, best, and I don't know if you'll be able to answer this question because you're not in the, World Health Organization,
Right. Right.
but best case scenario, when could this all be over? And in the
Man,
worst case.
if I could become like the Wizard of Oz and just tell everyone exactly what to do and make everyone just stay inside and literally quarantine and get out none, it could be like in May. And that's nothing, right? But if people keep acting in selfish manner and like, well, I'm young, I'm not worried about it, and keep spreading it, they're saying that it could be the middle of summer, it could be beyond that. And that's the reality of it. That's the whole flattening of the curve. If we could slow it down and make it where the R naught, instead of 4 people, is 2 people, then that exponential number is a little bit slower, because I mean, people are going to get it. And the thing that we worry about is the hospital systems, because like I said, can you imagine if your mom or your mother-in-law needed a ventilator? It could depend on how quickly we flatten that curve out, because there are only so many ventilators in the United States. And the
Yeah.
fact is, if we don't slow it down and flatten that curve out, there's going to be a place where, sorry, Shaun T, I don't care who you are, we're all out of ventilators. So your mother-in-law is just going to have to basically, see what happens, and we'll
Yeah.
support her as much as possible, but she's unable to breathe on her own, so she probably won't live that long. Like, that's what we're looking at. So it is totally dependent on everyone taking their own responsibility and just really realizing that you can make a difference by not doing anything and just staying inside and away from people.
Yeah, just by talking about flattening the curve, having people say we have to wait 2 weeks, and oh my gosh, I have to be in the house for 2 weeks. And I'm like, in 2 weeks, if you don't go anywhere, like what
You're
they're
not going to
doing in
die.
Italy, no, but not even that. Like you literally flatten the curve,
Yeah,
because
no, 100%.
imagine the people in Italy, they didn't quarantine themselves, and
Exactly.
they're out and they're at the shops and they're going to work and they're,
Exactly.
passing money back and forth, right?
Right, right. And that's the
That
difference between China and Italy. China basically came in and they're like, you don't get an option. Italy waited too late.
Mhm.
And the word is we've waited too late, but the curve can be flattened sooner than Italy based on what we do as a country. And we have to take responsibility for that and just realize this too shall pass, but how fast it passes totally depends on the individual and how much you take responsibility for that, the whole concept of self quarantining and socially distancing yourself.
Yeah, I'm all for a full lockdown
Absolutely. No,
because
me
I just
too.
don't want people to get sick. I mean,
Exactly.
we have a bunch of fit fam out there, and while they work out, some of them are in their 60s
Oh yeah.
and 70s, and we
Yep.
want to make sure they're healthy and happy too.
Yeah,
Dr.
absolutely.
Lauren Fitzgerald, you are incredible.
Thank
Thank
you.
you so much. I appreciate it.
You're welcome. You're welcome. Thank you for having me. I appreciate it. And I hope your listeners get something good out of it.
They will. Ready? So I'm gonna do an intro on the side and
Okay.
an outro.
Okay.
So, well, I'm glad you introduced yourself. I was gonna ask you if you wanted to just send
Yeah.
me a quick paragraph, so I could just. I mean, I know enough about you that I could say it, but
Yeah.
I want this to be more medical based
Yeah,
rather
for sure.
than, because I'll say, today on the podcast we're gonna have Dr. Lauren Fitzgerald. She's not a I just want to get the
Yeah.
verbiage so that I
Yeah.
can
Yeah.
say it
For sure.
correctly.
For
And then
sure.
at the end, I'll have it.
For
Thank you.
sure.
Oh my gosh,
You're
this is
welcome.
crazy.
I know, but
Stop recording.
if it makes yeah, let me stop recording.